Today's guest is someone whose journey reflects the whole spectrum of medicine, from a medical student from this very university to an oncological surgeon and now the Rector of Medical University of Pleven. Along the way, he played an important role in robotic surgery and minimally invasive surgery. Professor Dobromir Dimitrov, thank you for joining us.
Thank you so much for your invitation.
How are you feeling today?
Good. I'm still busy with some administrative tasks, but I'm okay.
Yeah, it was very nice hearing from you. You studied here and became a doctor and a surgeon. What made you go beyond that and become a rector?
I never planned to become a rector. It's
Okay.
really true. I just simply wanted to improve the environment around me.
Okay.
And over the time I realized that by leading a university, I could help thousands of future doctors instead of only the patient that I treated. And probably this is the good things. I can improve all the negative parts of our education up to the moment that I see. As a rector, I can try to remove it and to become a better.
Okay. You have seen generation of doctors. What is the one habit you have seen repeatedly in students who later became exceptional doctors?
One word, curiosity. If you have curiosity, everything will be okay. You're doing to ask the question all the time and to try to learn more and more and more. If you don't have a curiosity in medicine, you lose yourself, for sure.
Okay. So you have to be curious.
Yes.
And what is the one mistake almost every young doctor makes?
Thinking that they must know everything.
Do you think the good doctors, they also don't know everything? They have some lackings also?
Absolutely. It's usual to have. Even yesterday, I have seen for first time very unusual case in my career, and we couldn't help to the patient. We couldn't find the tumor mass. It's happening for first time in my career, but it's happened. And right now I know how to prepare it better and better. How can I correct this my mistake from yesterday?
Okay. Let's talk about the future of medicine. Has AI changed what students should focus on learning?
Absolutely. The AI will remember more facts than any human. It's really true. This means students should focus more on critical thinking, communication, ethics, empathy, clinical judgment. This is the AI will be just the instrument in our clinical decision, in our education, in medical education. But this is more important that we should save our human characteristics.
I want to ask something more about the AI. Do you think AI will eventually become better and somehow it will replace the lecturer or medical settings?
Yes, absolutely. Even now we use as a educational instrument in our university. We prepare the testing, we prepare the lecture, we prepare the laboratory task for the students using by AI. In the Department of Physiology, Pathophysiology, in pharmacy faculty, they have been used even now. And you know, after 5 years, after 10 years, probably it will become better and better compared with now. If you remember, 3-4 years ago, the first ChatGPT and chatbots was very weak, and was as a historical instrument for something did it in the history. But right now, everything is absolutely new. The information is new and sensitive and can help us even in the clinical decision in the medicine.
Do you think it will become better than human being or not?
It will be better than human as the memory and as the know the facts. But we will learning how can use and improve these facts better and better. This will be the difference. For example, if you think in surgery, can the AI help us? Of course. Probably after 15-20 years, the robotic system will be used AI instruments take the right decision in the moment, directly in the second.
Okay.
The AI will show this is the left ureter, this is the mesocone, this is the presacral fascia, and we will know all of this. You can cut here, you cannot cut here.
Yeah.
This will be very helpful, even for the young surgeon, because right now the learning curve for the surgeon is around 6-year education as a magister, 5 to 7 years as the resident. After that, 5 more years for single experience or your personal experience in the surgery. This is more than 15 years education. With AI, we can doing shorter this learning curve. I'm absolutely sure.
Okay. Which specialty you think will become much more important in next 20 years?
I believe that preventive medicine, geriatrics, oncology, robotics, data, medical data science, telemedicine, telementoring will become increasingly important for all of the medical staffs and all the medical decisions. For example, geriatrics is one of the newest disciplines, and we should put in our education also. The genetics is really improving very fast right now. If you stop teaching the genetics for a couple of several months, you lose a lot of information right now because it's very dynamic.
It is.
And probably I even believe that a little bit more mathematics in physics will be better to know, because right now, you know, most of the medical students prefer to teach the medicine because they're afraid from mathematics and physics. But right now with AI, we have so many mathematics and physics in the different devices that we are using in the clinical environment.
If you could redesign medical education from zero, what would you change first?
I would like to introduce at first the earlier patient contact. Years ago, 20 years ago, I was a student as you, and I support this new program in that moment that the first patient contact will start in 4th semester. Right now, in the second year, in the 4th semester, you start with primary patient contact. I believe that even earlier will be better, because the communication skills, the soft skills for the young doctor, generation of doctors will be very, very important. The other things is the simulation, of course. Simulation, we should be very well prepared on the simulation before to try to do it on the humans and the patient, real patients. That's why right now we will try to establish 2 modern simulation centers, one for nursing in our university, and the second will be for the students of medicine. And we will increase this capability of education.
I believe there is a significant gap from graduating from a medical school and then becoming a doctor. There is a transitional crisis of a doctor being fully confident and making independent decisions. Where do you think is the gap coming from? Is it the education, medical education, healthcare system, or mentoring, or something else?
This gap is really true. The gap exists because medicine is too complex to master in 6 years. That's why it's very important for this initial 6 years to have a basic knowledge, basic skills, and after that you should improve in the residency years, and after that to improve with personal education for a very narrow specialization. I told you for the surgery it costs more than 15 years. The responsibility in our profession is too high. That's why we should be very well prepared, and it's not possible for 6-year education to know everything in medicine, because right now the information in medicine is really huge. That's why we should learn the medical student how can they ask the right questions. And all the AI tools will show us a lot of information. If you open the medicine book, you can try it in our library. We have books from 1950, 1960. You can see that for one disease, we have very simple information. It was very easier to learn it. But right now, for the same disease, you have huge tons of books and chapters about this disease because the information and knowledge improves in the last decades.
So, how can we change it? How can we solve this problem?
Probably the decision will be to divide the medicine education in earlier years.
Okay.
First 2 years
like USA.
Like USA.
Okay.
And after that to divide internal medicine, surgery specialty, supported discipline as genetics, laboratory.
Okay.
And this will be all. If you choose surgery, you learn just the surgery specialties.
Oh, you think that?
Yes, probably. Otherwise, it's impossible.
Okay.
The 6 years is absolutely not enough for providing the real education for the students. The information is huge in the medicine.
It brings to my next question, which is almost as similar as you just answered. You have spent your career training doctors and students and also leading the university. What do you believe is the one issue in medicine that deserves far more attention than anything else right now?
Prevention. I believe that prevention will be much more important for the next couple of years. We invest enormous resources in treating disease, but not enough in the preventing.
Okay.
If we want healthier societies, we must focus much more on the screening, early diagnosis, healthy lifestyles, and public health education.
So prevention before someone is even sick.
Yes. If you check right now, for the earlier test of colorectal cancer, breast cancer, right now they're testing a lot of blood tests.
Okay.
And the blood test will show us months and years before the disease coming. And I believe that this is the right way for improve our results and to improve the survival rate of the community, of the societies.
Okay. It is a hard decision to choose a specialty, and everyone goes through tough time and uncertainty. What would you advise to a medical student how to choose a specialty?
It depends on you, on your character and your own vision about you and your career. You should feel deep inside in your heart. And if you have some a little bit fear about it, probably this is your choice. You should know that every student should know that probably the mistakes can happen and you can choose another specialty later on. But this is what I most frequently see in my contact with the students and young doctors, is that you should feel in deep in your soul to feel your specialty. It depends if you like to work with hands, and if you like devices, machines, different devices, you can choose the surgery specialty, urology, gynecology, obstetrics and gynae. If you prefer to be calm down, to be relaxed, to work on the computer, to do not have a contact directly with the patient, you can choose the clinical laboratory, for example. It depends on your characteristics and your character as a person, and what is your deep interest of something.
One final question to you. If you could talk to yourself, the one in final year medical student, what advice would you give him now?
To keep working and keep doing, and to do not surrender.
To do not surrender.
Yes.
Surrender to yourself or other people?
To myself.
To myself, okay.
Surrender.
It was very nice having you, Professor.
Thanks so much.
Yeah, thank you.